Hey everybody, this is Dr. Shelby Blankenship, and I am going to be hosting the MMOA podcast today, presented to you by the Institute of Clinical Excellence. Today we're going to be talking about osteogenesis imperfecta and a quick case study of someone that I saw here in clinic, and just kind of give you some background of things you can work on with these folks, especially since there's just really not a lot of research out there, especially when it comes to weightlifting. So just to give you a little bit of background on osteogenesis imperfecta, it is a genetic disorder of connective tissue. So it's usually where the type 1 collagen is just not doing what it needs to do. And bone fragility is really common. You'll hear people call it like the bone brittle disease, low bone density. So those two kind of ring a bell for those who have like osteoporosis. It's kind of that same mindset, but there's also some other things going on. So there's a wormian bones in the skull. There's tends to be increase in laxity. They tend to have issues with hearing. You'll see some folks with like cochlear implants or just regular hearing aids, pretty common. And then you'll also see some issues with like heart issues, like mitral valve stenosis, aortic valve stenosis, etc. Now, there's multiple types of osteogenesis imperfecta, so we're going to kind of just focus on the person that I saw. She didn't actually tell me what type she had, but it was definitely more on the mild side. She was in her mid to late 60s, so definitely living a long and normal life. Sometimes with this type of disease, they can have a pretty shortened time period where they only make it to like 1 year, or they only make it to like early adulthood. But there are folks that do live into that late adulthood or what they consider like a normal lifespan. As far as the research currently that we have for osteogenesis imperfecta, when it comes to like strength training or anything like that, there's really just not a lot out there. There's some kind of one-off case studies of like, there was a guy who was an Olympic weightlifter, there was an American football player, but there's not really anything, just because there's not a ton of these folks. So I just kind of wanted to give you my thoughts on what I did with this patient, and also kind of give you what the research said. So based on the research, they obviously are kind of like emphasizing strength training, but they don't really give you many parameters when it comes to that. Sometimes, like there was a 2014 study that really focused on swimming being like the thing. And we all know like swimming is great, but it doesn't necessarily give you that impact to bones, which doesn't really help us out in that realm. As far as like children, they did a study with kiddos, and they only gave them weights up to 1 kilogram. Again, just really not a whole lot of data that you can do with that. But really what we want to kind of think about is how much in the past people have really looked at like overprotecting these folks, and that just kind of ends up being to their detriment. We are not loading them appropriately. We're not really advancing them forward. So they tend to be underfueled, poor strength, just tend to be more sedentary and live in this bubble. And honestly, like depression and like cognitive issues tend to be an issue because they don't have that stimulus, especially as kids, that most folks have. So that's just something to kind of keep in mind when you're approaching these folks. The other thing that I want to talk about is like these osteogenesis imperfecta tend to have like a higher turnover rate when it comes, because they have higher vascularity and increased cellularity. So it definitely, while they have more brittle bones, they do get a higher turnover rate. So it's not like the end all be all like we think about with some of our guys when they have like a hip fracture and it's immediately like to the nursing home or those kinds of things. This is not something like it tends to occur quite often. So it's not, as I would say, it can be really scary depending on the person and how they kind of approach this, but it's not something that's like abnormal for them. But we still obviously don't want to cause any fractures if we can help it. So for my patient that came in, she had, like I said, about mid-late 60s, had some shoulder issues going on, had a long history of falls, and very fearful of falling for obvious reasons, not only from the fear of falling side, but also the fact that she also has osteogenesis imperfecta and was concerned, how many falls can her body handle. She was probably about 4'10", 4'11", less than 100 pounds, pretty small individual, very participatory, and also had some grip strength issues due to another comorbidity that we'll address in a second. So first things first, obviously checking range of motion, checking her base strength level. This is not somebody like I'm going in and like cranking on them. Her capacity for fatigue and recovery was pretty low. Like it didn't take much to get her pretty tired. So we really started out with isometrics for her shoulder in external rotation and abduction. She tended to do much better with external rotation than abduction just because of the lever arm. So we kind of focused there. Then we slowly transitioned into doing like a shoulder three-way from a sideline position. If you've ever taken the extremity class, it's a great one that you'll see there. And then we kind of segued into more functional training sprinkled in there. So think like landmine press was really important. We did a lot of things for grip strength. So deadlifting, step ups, things that required grip strength in both hands versus just a barbell. One, because that's going to be the type of weights that she had at home that she could kind of replicate her exercise program. But two, it made it more obvious because she had already had a rotator cuff surgery on the other shoulder, how much she needed to strengthen that shoulder as well. So we kind of did a twofold there. But when it came to balance, a lot of it was fear. It really wasn't her balance so bad. We did the mini best test and she stayed about like a 24 out of 28, which is actually not too bad. Her recovery as far as doing the reactive balance was pretty good. It was more like stepping over large barriers or turning her head with those while she was walking. And it was more out of fear than that she vestibular couldn't handle the stimulus, which I thought was pretty interesting. So we kind of started to incorporate those into our training session as well as the cognitive piece, because that one tends to throw people off a little bit, especially when hearing is a limiter, because she also had a cochlear implant and a hearing aid on the other side. Now, as far as the exercises go, that's kind of the metric we went through. So isometrics, and then we started doing some sideline, more shoulder specific, and then branched off into doing landmine press, deadlifting, step ups, etc. We also made sure to really address protein and sleep. This population tends to be extremely underfueled because one, they don't have like a bunch of muscle mass, so they don't tend to be as hungry as somebody like me who's 5'5" and about 140, 150 pounds. And so we had to really, really emphasize protein intake. One, not only for like the muscle gain standpoint, but also from the bone health standpoint. If we're not getting enough protein in for these folks, their capacity to recover is not going to be what you need it to be to get the weight on the bar or weight in their hands that needs to happen. As far as sleep goes, a lot of these folks, especially in this age demographic, are getting up multiple times a night, and there's a multitude of reasons for that. But if they're, again, not getting that 7 to 8 hours of sleep and it's quality and it's consistent, their recovery is not going to be what you need it to be. You really have to emphasize those two things to make sure the ecosystem is in a good spot so that things like a fracture or a fall or any of those kinds of things like don't tend to impact them as much as it could. And especially where with this diagnosis, we want to be really aware of recovery. And I'll give you a little side note as well, as not only did we were challenged with osteogenesis imperfecta side, but we are also challenged with her having RA. So grip strength and hand strength was definitely something very limiting, but also just like overall fatigue levels. So if we can't impact her fatigue because we can't get her recovery in a good standpoint, you can see where we're going to have some issues there. So just kind of think about those things. We definitely want to make sure we're maximizing that capacity as much as possible. So making sure we've got exercise, protein, and sleep in a good spot. Now, as far as MMOA Live goes, we've got 2 coming up this weekend in Paoli, Pennsylvania, and Highland, Michigan. And then we've got L1 coming up October 16th. And L2, October 17th. We hope to see you there. Hope this was helpful for you, and have a great day.